friends, welcome to a new lecture on stomach. MCQs. The first question. The following are complications of trichobazaar except hematemesis is seen in trichobazaar. Perforation and peritonitis is seen in trichobazaar. There is no malignancy association in trichobazaar. Trichobazaar is not associated with malignancy. Complications are obstruction, bleeding, perforation and peritonitis and small bowel obstruction. Then question number 2. A female in her 20s presents with complaints of pain abdomen, abdominal distension and vomiting. On examination, she is found to have alopecia and crepitus in epigastrium. What is your diagnosis? See, alopecia, crepitus in epigastrium, pain abdomen, abdominal distension and vomiting. See, pain abdomen, abdominal distension and vomiting suggests there is some obstruction. And alopecia mainly suggests that it can be eating of hair, that is trichobazaar. Next, question number 3. In case of upper GI bleed associated with stress gastritis, all are true except in case of upper GI bleeding associated with stress gastritis. Surgery should be done if transfusion requirements is more than 6 units. True. Vagotomy may be added because there is gastritis. Vagotomy may be added. Surgery involves anterior gastrostomy with ligation, of bleeding ulcers and superficial erosions. False. Surgery is not routinely done for stress gastritis. Total gastrectomy is rarely indicated. True. Next question, number 4. In case of upper GI bleeding due to stress gastritis, all of the following decreases bleeding risk except treatment of sepsis, improvement of BP and correction coagulopathy will improve the risk of bleeding, decreases the risk of bleeding, whereas elective ventilation is not generally needed. Treatment of sepsis, improvement of BP and correction of coagulopathy decreases the bleeding risk. Next question. Fifth question. Common sites for Cushing's ulcers include all of the following except Cushing's ulcers are due to increased intracranial pressure and it is present in esophagus, stomach and first part of duodenum. Cushing's ulcers are not common in distal duodenum. Then question number 6. Most common site of Curling's ulcers are, whereas Curling's ulcers are most common in duodenum. Then question number 7. Erosive gastritis occurs most commonly at fundus of the stomach. Then question number 8. Curling's ulcers is seen in burns patients most commonly. So, thank you guys for watching my lecture. Thank you.